Gentleman yields back, and now the chair recognizes my friend and colleague from California, Dr. Ruiz, for 5 minutes.
Thank you, Mr. Chairman. Pollution is real. Climate change is real. We're starting to see extremes in weather. In fact, I live in the desert in the Coachella Valley, and all of you probably saw on the news the tropical storm Hillary. I can tell you, I live in the desert. We haven't seen a tropical storm in the desert. And you're starting to see more and more of these kind of phenomena. And pollution is a deadly threat to public health. Hundreds of studies and peer-reviewed literature have found that these microscopic particles, the PM 2.5, can reach the deepest regions of the lungs. In fact, it goes beyond the lungs. It goes through the lung-blood barrier and straight into the bloodstream. Exposure to fine particles is associated with asthma exacerbation, asthma deaths, chronic bronchitis, decreased lung function, respiratory diseases, and even premature death. I've seen them in the emergency department treating patients. I've seen them firsthand, the dangerous impacts of these fine particle levels. So this deadly pollution disproportionately affects the most vulnerable amongst us. Like, don't get me wrong, it affects everybody, but it disproportionately affects the most vulnerable amongst us, the children, seniors, those with chronic lung and heart diseases, and those with low-income populations that don't have the resources to protect themselves. In the western part of my district, the San Jacinto Valley has seen an increase of warehouse development, for example, especially along the I-10 freeway. These increases in development have brought on an influx of trucking traffic, causing more car exhaust, an example of a fine particle pollutant to run through the streets and the neighborhoods. And this is happening in cities across my district, like Banning, Beaumont, and Hemet. In fact, I just spoke with some constituents about the haze of dust and pollution over the Coachella Valley as well. With the winds and the tropical storm Hillary, it's kind of laying over there, and we have hazardous air quality in my district. In fact, Riverside County is one of the worst air qualities in the country. The American Lung Association has graded the county in an F grade for annual particle pollution. However, Congress has made some common sense investments to help communities across the country reduce transportation-related pollution, including harmful particulate matter, through funding for the Diesel Emissions Reduction Act program, also known as the DERA. So the DERA provides federal funding for states and territories to replace dirty, polluting diesel engines with cleaner, more efficient technologies. Nothing wrong with that. My home state of California regularly takes advantage of this opportunity, as do many others across the country. So, Mr. Byrd, it appears that your state received over $2 million in DERA funding in 2021. Are programs like DERA an important tool for states as they work to reduce pollution in communities?
They are, and that's, of course, part of a comprehensive plan that states and EPA and Congress have put into place to reduce the burden of air pollution across the country that has been so effective.
Thank you. And Ms. Cooper, as states implement air pollution standards, how important is it that communities have access to resources in order to reduce pollution in their area, especially in communities that are disproportionately affected by pollution?
It's very important. Unfortunately, because of historical patterns of residential problems and systematic racism that has resulted in many Black and brown and low wealth individuals being in communities that are closer to highways, closer to polluting plants. All of these things impact the quality of air more on these communities than others. Although, as has been stated, everyone is affected.
Thank you. You know, as we approach this, we need to put people over politics and really put the health of individuals first and foremost. I'm a public health expert. I put my blinders on. I work with anybody in a bipartisan way to make sure that the end result is better health for individuals. And this is something that's very clear, that the studies in the medical and the public health literature have a direct link between air quality and quantity of life. And we have seen some studies that show a decrease on average by 10 years of individuals who live in poor air quality areas. And so here we are addressing an EPA study that will help improve that even more. So these are rules that have real life impact. Now, how many of us want to live long enough to see our grandchildren graduate from high school? How many of us want to see our children get married and have a great life and start their career? I do. So if we all want to have better lives, and we all need to start working and have common sense and put people above institutions. And no matter how hard it is to address this issue, no matter how hard it is for states to come to compliance, the government needs to work for the people, being compliant for the health of the people, so that people can have better lives. I yield back.
Gentleman yields back. The chair now